Do you know that the cost of knee surgery for knee osteoarthritis in the Philippines average between 200,000 pesos per knee and around $31,000 in the US, plus the cost of rehabilitation after surgery? But do you really need surgery? In this video, you will know if surgery is right for you and possible complications as well as realistic expectations after knee surgery. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you health tips and home exercise programs that you and your family can benefit from. Your knee comprises the lower part of your thigh bone as well as the upper part of your shin bone as well as your kneecap. There is a substance in between these two bones that cushions your bones, preventing it from rubbing each other. But with knee osteoarthritis, aging as well as being overweight causes a wear and tear in this cartilage, thus resulting to the rubbing of bones every time you move and is the root cause of your problem. Knee replacement, or otherwise termed as knee arthroplasty, is a surgical procedure that is done to resurface damaged bones caused by knee osteoarthritis. Metals and plastics are used to cap damaged bones in the knee joint. Although knee surgery is one of the options for knee osteoarthritis, the average cost of knee replacement per knee in the Philippines average around 200,000 pesos and in the US $31,000 per knee. Knee replacement in the US is usually covered by Medicare. You need physical rehabilitation to strengthen the muscles around your knee joint, to teach you how to walk again and how to be independent again without jeopardizing your surgical site. Physical rehabilitation is usually scheduled 3 times a week for 1 to 2 months, depending on the rate of your recovery. Some insurance companies will cover physical rehabilitation and some won't. So it would always be best to talk with your insurance company first so that this way you will be financially prepared. Is surgery for you? Answer these questions in your mind. What is your pain scale from 1 to 10, with 1 being minimal, 5 moderate, and 10 severe? If your answer is between 9 and 10, then most likely surgery may be indicated. But answer these questions again. Have you lost weight? Since weight management is a mainstay treatment for knee osteoarthritis, whether you have or have not gone through surgery. Have you consistently committed in doing your home exercise programs or knee exercises that can help you conservatively manage knee osteoarthritis? Have you had rehab? And how long have you had rehab? Although knee surgery is an option in treating knee osteoarthritis, it shouldn't be your first option in treating knee osteoarthritis. Do conservative management first, like physical therapy, because you're going to do it anyway after surgery. Lose weight if you are overweight, because you would still be obliged to do weight management after you have your surgery. I would say consider surgery if you have severe pain and stiffness that limits your usual activities, and if conservative management failed to decrease your symptoms. There is no requirement for knee surgery. It is only based on the intensity of your pain and your ability to do things independently. Before we proceed about possible complications as well as realistic expectations after knee surgery, I would really appreciate it if you can take only 1 second of your time. So please click the like button below if you're learning something out of this video. It will help this channel as well. Majority of my patients experience total or drastic improvement in their pain scale after knee replacement. But do not expect too much as well. You cannot do beyond what you can do before you develop arthritis. And you are to avoid high impact activities like jumping. But you can do unlimited low impact sports. You can do unlimited walking. You can go swimming. You can drive your car, and you can also do cycling. If you're worried about possible complications after knee surgery, the incidents are low. Possible complications would include infection, but these can be treated well with antibiotics, blood clots, which can be prevented with physical therapy, and also there are some or very few instances where there are loose implants, by which the joint needs to be replaced. How would you know then if you have severe form of knee osteoarthritis? Normal x-ray plus your symptoms would already be enough. This is an example of a normal x-ray of the knee. You will notice uniform joint space in between your two bones. This indicates healthy cartilage. And this is an example of a knee with osteoarthritis. You will notice loss of joint space in between the two bones, and this indicates damaged cartilage. I would suggest that you try conservative management first in treating knee osteoarthritis. Try physical therapy. It had helped a lot of patients. Your other option would be corticosteroid injection, but some of my patients would experience pain again after 3 to 4 months of injection. You can also use topical pain gels to help relieve the pain caused by knee osteoarthritis. I have here BEFREEZE. This is formulated with Arnica montana extract, which had been proven in clinical trials to have the same effect as that of ibuprofen in relieving pain, without the side effects. Plus, if you are now committed in doing your home exercise programs for doing free exercises that you can do on your own at home to help manage the pain caused by knee osteoarthritis, I have a video here. You can check on it. Aim to do these exercises here 3 or 4 times a week. It will definitely help you. I hope that this video had been able to guide you in knowing if surgery is for you if you're suffering with knee osteoarthritis. If you have reached the end of this video, please comment stairs in the comment section below. I would really love to hear from you. Please share this video to your friends and family members so we can reach out and help more people. Thank you very much for watching. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.